We're live. Hey you guys, I wanted to talk, ooh, this is so loud. Let me turn it off real quick. So I wanted to talk to you about a very common thing that we have come into the office. And a lot of people go other places to get lipo. Maybe they want more aggressive, real snatched waist. She had lipo done at another doctor's office, and you can see they did really aggressive lipo, but she's left with this underlying inflammation and pigmentation. Her lipo was about 8 months ago. She's a model, so this is something that has affected just kind of her everyday work life. So we do a combination treatment here. We do a combination of Aerolase. Aerolase is a 1064 laser. Here we go, take this off real quick. Reduces underlying inflammation. We can also treat really dark melasma with it, as well as darker skin types for hair removal. And then we do the Venus Legacy, which is a radio frequency. It also helps break up inflammation, smooth out the tissue, and it helps kick that out the lymphatic system. And then lastly, we do something that's called Mesotherapy. And we do these, it's a technique that we use. Wait, let me switch it here. It's called Napage. It's just a really fancy name for an injection. But what we do is we go through and we barely, we just barely inject the surface, and it does help break up pigmentation. With mesotherapy, we're able to kind of do our own concoction, and so we can put in fat reduction, we can put in depigmentation ingredients, and with about 4 to 6 treatments, depending on how bad the pigmentation is, we can actually have this resolved back to her normal tissue. Thanks guys, stay tuned.